social worker. At Circle of Care, my role is a community social worker as well as a care navigator with the Mount Sinai Family Health Team. And I'm also the professional practice lead for the social work team. In the community, we work with seniors ages 55 and over, as well as caregivers. My mom was always that mom who knew all of my friends' business, and they would come over to sit with my mom and talk to her and share all their problems with her and their issues at home or whatnot. And she was always there to provide them support and a listening ear. And I think that's really what drove me to go into social work. I don't know, I guess I always liked to help people, to listen, and I just always felt that I had a passion for children and for seniors who feel that they don't really have a voice, and that nobody really listens to them. A few years back, I worked with a client who's a senior that has a child, or she's a teenager now, that lives with him, and he's the main caregiver for her. And then unfortunately he got ill in later years. At some point he was unable to work anymore, and he was unable to provide to his daughter. And by the time that I had the referral, they had no money to pay for rent, and he was already about to be evicted. Connected with many different organizations and services to help cover as much rent as we could to buy us another couple of months. Fairly quickly, to our luck, he was accepted to subsidized housing. We had a couple of weeks to really arrange his house to be moved. We needed money to move him. We needed to arrange all the paperwork for him to get into the new housing. There was a lot of involvement. Circle of Care supported also a lot. And we were then able to move him and his daughter to housing before they lost it and remained essentially homeless. To this day, he calls me all the time just to let me know that he's still alive and that he's okay, and he keeps telling me how much he loves me. I'm his family. I saved his and his daughter's life. So that's the best feeling, really.